Just how dire is this outbreak?
So it's looking really bad, Peter. At the moment, the main problem is that we're now detecting large numbers of cases in health workers in Port Moresby in particular, and a number of urban centres around PNG. So when cases are being detected in those settings, it means that you're starting to lose healthcare workers. They can't keep working in hospitals. And as more cases present themselves at hospitals, you're going to see a really large amount of pressure coming on PNG's health system, particularly over the coming weeks in the aftermath of some really big community ceremonies to recognise the late founding Prime Minister of PNG, Sir Michael Somare, who died about 2 weeks ago, and the last of the funeral ceremonies was held yesterday.
So what kind of facilities and medical structures, in what shape were they already before this?
PNG's health system does struggle. I mean, it has a lot of big challenges. Things like HIV, malaria, TB are regular daily things that health workers around the country are dealing with. So to add to that, COVID just adds to the complexity and the challenge for PNG's healthcare workers. And the system is really not that well funded. It's struggled with issues like corruption. So to add this to the mix, the demands of managing COVID cases, it just puts a lot of load on PNG's health system.
Considering the danger, is our response fast enough?
I guess it would have been great if it could have been there a couple of weeks ago. But, it seems like the government is moving pretty fast. And the things that are being talked about now are really positive steps. So to get more vaccines into PNG hasn't been able to access its allocation yet from the COVAX facility. So talk that Australia will send an emergency dispatch of vaccines to PNG so that healthcare workers primarily can get vaccinated. That's a huge positive step. Also, AUSMAT workers going up just to help with some of the planning and the response to the situation at the moment. That will be very welcome in PNG, I think, and it will just help local officials to deal with the situation that they're facing. There's also talk that over coming weeks there might be more Australian health workers able to go up and help. And given the number of cases that we're seeing in some of those major hospitals like Port Moresby General, I think that will be a really positive step as well and can just help PNG to deal with the number of cases that it's facing, but also get ready for what could be another wave of transmission based on these big public gatherings that we've had over the past couple of weeks.
What are some of the challenges that PNG faces, though, and in particular getting vaccines to those areas that are isolated? There's so many regional and isolated parts of PNG, isn't there?
Yeah, there are huge challenges in getting vaccinations into PNG, and that's the case with other things. I mean, there was a polio outbreak a couple of years ago that required a big national vaccination campaign to get vaccines into rural and remote parts of PNG. Something about this current focus with vaccination, it will very much be about those on the front line, healthcare workers. And so there is a plan over the next 12 months for PNG to get about 600,000 doses of vaccine. And that will target those people who will be dealing most readily day to day with coronavirus cases to get them vaccinated. So this is really what's being talked about at the moment. It's just kind of speeding that up, getting those vaccines in as quickly as possible to give healthcare workers the best protection they can have, while measures are sort of tightened around the rest of the country. There's talk of a lockdown of sorts over the next couple of weeks, just to try to limit the spread of cases and to really get a handle on what the picture is.
I mean, again, with the facilities, obviously PNG is not a rich country. How do you get messaging to people and places that are isolated where, the communication systems aren't what we would be used to, for example?
Yeah, that's exactly right, Peter. And, the communication challenge is a really big one in PNG, and getting the message to communities, getting people to embrace the idea of vaccinations, that's going to be a huge just public health challenge over the next couple of months. But these are, challenges that PNG is dealing with day to day with other big health challenges like TB, like malaria, like HIV. So if you put it in that context, COVID is another big challenge for PNG's health system. But it's a health system that is dealing with those big challenges every day.
There have been claims that morgues have been overflowing as well. I mean, is that something that's likely to worsen as well?
Look, it's a constant challenge for PNG's healthcare system. I mean, particularly in Port Moresby, where you have a lot of urban residents, people living in squatter settlements, things like that. It can be really difficult for people, if they're dealing with the death of a loved one, to actually deal with things like hospital bills and things like that. And you do actually see cases where people's bodies aren't claimed for some time, and that can be an issue.
Right.
And one of the challenges in PNG at the moment is there is stigma around COVID-19. So public awareness, public education is going to be a big part of making any vaccination campaign work.
How exposed is Australia's north here?
This is a big challenge in the Torres Strait. Western Province is the PNG province that's closest to Australia, and it's just a few kilometres from some of the islands of the Torres Strait into Western Province. So you've already seen Queensland is getting vaccinations into those outer Torres Strait Islands to protect residents there. And I think one of the big focuses over the next couple of months with vaccination will be trying to find ways to get vaccination into PNG's Western Province. The other border that's a challenge for PNG is its border to the east with Solomon Islands. That's PNG's Bougainville region, and that's very close to Solomon Islands. And again, Solomon Islands is trying to get its vaccinations rolled out, and it said it's going to prioritise putting vaccinations on that border with Solomons as well, with Bougainville rather as well.
And do you suspect that China would be watching our response very closely because, in the past it's had its eyes on PNG?
I suspect they will, but I think in the context of PNG needing to access vaccines, it can't be seen in geopolitical, vaccine nationalism terms. China has promised vaccines to PNG. It's pledged 100,000 vaccines. And I think the main sticking point at the moment will be WHO recognition and approval of that vaccine. And if that becomes an option for PNG as well, I think that could be a really positive thing. I think it's important in these times not to be too worried about these issues of vaccine nationalism. The main issue is the health challenge. Yeah. And if a vaccine is available for PNG, it should be available.
Okay.